Have you ever seen fingers like this? This is called as clubbing. This simple clinical sign can help you diagnose serious hidden diseases. Let me show you how. What is clubbing? Clubbing is a painless bulbous enlargement of the distal fingers or toes due to proliferation of the connective tissues, particularly on the dorsal surface. What are the common causes of clubbing? Remember the mnemonic club. C stands for cyanotic heart disease, L stands for lung cancer, which can be primary or secondary. U stands for ulcerative colitis and B is for bronchiectasis. However, there are other causes of clubbing as well. Let me tell you all the causes system wise. First of all, what are the respiratory causes of clubbing? The common causes include bronchogenic carcinoma, interstitial lung disease, especially idiopathic pulmonary fibrosis. However, clubbing can be present rarely in non-specific interstitial pneumonia and respiratory bronchiolitis associated ILD. Other causes are chronic suppurative lung conditions, which are a very common cause of clubbing in respiratory conditions, which include bronchiectasis, lung abscess, and empyema. Other causes are chronic hypersensitivity pneumonitis, and other respiratory causes of clubbing may include mesothelioma, asbestosis, sarcoidosis, cystic fibrosis, and even tuberculosis. What are the GI causes of clubbing? These include cirrhosis, especially hepatopulmonary syndrome, inflammatory bowel disease, that is ulcerative colitis and Crohn's disease, and small bowel lymphoma. What are the cardiac causes of clubbing? Infective endocarditis and cyanotic heart disease. Other causes of clubbing include thyroid disease, that is thyroid acropathy, familial, that is hereditary clubbing, and clubbing can even be idiopathic. Now the question is how to check for clubbing. For this, examination needs that demonstrate Schamroth window test. Put the nails together. Normally there is a diamond shaped gap. However, if there is no diamond shaped gap, this is called as clubbing. In clubbing, there is increased curvature of the nails and obliteration of angle of nail, that is loss of Lovibond's angle. Nail may have a drumstick appearance. When the nail is viewed from the side, the skin fold of the nail and the base of the nail makes an angle which is known as Lovibond angle. Normally this angle is less than 165 degrees. However, in clubbing, the angle between the skin of the nail fold and the base of the nail is more than 180 degrees. Now let's discuss briefly about the history of clubbing. Digital clubbing was first described by Hippocrates approximately 2400 years ago. In 1976, Leo Schamroth, who was an internationally recognized cardiologist from South Africa, he described the sign, that is Schamroth sign. He has 3 episodes of infective endocarditis in 1975 and he developed clubbing. Now let's discuss about the grades of clubbing. There are 4 grades of clubbing. What happens in grade 1? That there is increased glossiness and cyanosis of the skin at the root of the nail, which is associated with increased fluctuation at the base of the nail bed. In grade 2, the normal angle between the base of the nail and the skin is obliterated, that is the Lovibond angle. That's why it is called as Lovibond sign. In grade 3, there is hypertrophy of the tissue of the nail pulp and the nail curves longitudinally to give a drumstick appearance, or it is also called as parrot beak appearance. In grade 4, bony changes involve the wrist and ankles and sometimes elbow and knees, and this is called as hypertrophic pulmonary osteoarthropathy. Now let's discuss about the mechanism of clubbing, which is a common viva question in exam. There are different mechanisms which have been described. For example, one mechanism is that there is increased blood flow in the clubbed fingers, which is caused by vasodilatation of the blood vessels in the nail bed. The vasodilator may be ferritin, bradykinin, prostaglandin, and serotonin. And the vasodilator is probably inactivated in the lungs in normal person, but when this inactivation is defective or there is right to left shunt, clubbing occurs. Another mechanism is that there is increased growth hormone in disease states, which causes excessive cellular tissue in the nail bed. Another mechanism is that clubbing occurs whenever organs supplied by the vagus nerve are affected. It has been shown that in bronchogenic carcinoma, vagotomy causes reversal of clubbing. Another very common mechanism of clubbing is that megakaryocytes and clumps of platelets may stream in the blood vessels of the digits and release platelet derived growth factor, vascular endothelial growth factor, and other chemicals as well. And the resulting there is increased capillary permeability, fibroblastic activity, and arterial smooth muscle hyperplasia, which could result in clubbing. Now the question is how to approach to clubbing in the exam, especially in the FCPS medicine short case. Command can be look at the patient hand or nails and proceed. So you look at the nails and there is clubbing. You confirm it with Schamroth sign and proceed as follows. Like for example, you will look for the following sign. First of all, you will look for nicotine tar staining of fingers. You will look for signs of infective endocarditis, that is, splinter hemorrhages, Janeway lesion, and osseous nodes. Also, you will look for peripheral cyanosis and palpate the wrist joint for tenderness, that is, hypertrophic pulmonary osteoarthropathy, uh, and I mean this HPOA, which is because of rapid painful clubbing, which is nearly always caused by bronchogenic carcinoma. You will also look at the eyes for eye signs of thyroid disease like exophthalmos, lid lag, lid retraction as a part of thyrotoxicosis. And you will also look for conjunctival pallor and jaundice, like for example, it can be a case of primary sclerosing cholangitis associated with ulcerative colitis or clubbing as a part of cirrhosis. Then you will look for oral cavity, that is, you will examine the oral cavity for central cyanosis. After that, back of chest examination for coarse or fine crepitations, like if you are suspecting interstitial lung disease or chronic suppurative lung disease or hypersensitivity pneumonitis. There can be bronchial breathe or decreased breath sounds, keeping in mind the other causes of clubbing in respiratory disease. After that, you will examine the precordium for any sign of murmur as a part of infective endocarditis or if you are suspecting cyanotic heart disease. Examine the thyroid if it is enlarged. And then comes abdominal examination for visceromegaly, shifting dullness, or any stomacytes or laparotomy scars, keeping in mind the diagnosis of inflammatory bowel disease and lymphoma. Last but not the least, you will check for digital clubbing of toes and pitting pedal edema. You may not need to do all of these examination steps because practically it is not possible. Any finding you get in the pathway of your examination, you can mold your next step of examination. Last but not the least, general look of the patient and surroundings is very important in the start of your examination. It will give you many clues. For example, spot diagnosis. Let's say it is a case of cyanotic heart disease and patient may have a syndrome like look, or for example any evidence of autoimmune connective tissue disease along with clubbing. Underlying condition can be bronchiectasis or interstitial lung disease. Likewise, general look of the patient like cachexia is very important because if patient has cachexia along with clubbing, it may point to malignancy or even tuberculosis. And also you will look for typical hepatic facies, like for example chronic liver disease as a part of hepatopulmonary syndrome, patient may have developed clubbing. You will also suspect for like nasal prongs, patient is taking oxygen therapy and there is clubbing, patient may be a case of respiratory disease or cyanotic heart disease case. And also you will look at the abdomen for any peg tube in situ. I mean patient with clubbing along with peg tube in situ might be a case of cystic fibrosis. So next time, if you see swollen fingertips, think deeper. Please like, share and subscribe for more quick medical pearls. And thank you so much for watching. Stay blessed. Allah Hafiz.